Welcome back to Champions of Care. We're talking about prostate cancer. In our previous segment, we talked about radiation treatment options, and now we're going to talk about surgical treatment options. With me in the studio is Dr. Muzammil Ahmed. Welcome.
Thank you very much.
You're an Oakwood affiliated urologist, and you have offices in a couple different locations. What are they?
Dearborn, Westland, and Taylor.
Great. Now, let's talk about these surgical options for prostate cancer. What patients are candidates for surgery?
That's a very good question. It really comes down to the type of cancer you have and your age. Generally, we find younger, healthier men are the best candidates for surgery because they recover the best and they have the best long-term cure. Gentlemen that are older tend to benefit better from radiation because the stress on their bodies are much less.
And there are different kinds of prostate cancer surgeries, is that correct?
Correct. Prostate cancer surgery has undergone a great evolution over the years. A lot of it has been due to technology and miniaturization technology and robotics. In the past, surgery used to be done through a big open incision with an extended recovery time where people would spend up to a week in the hospital. But more recently, with the use of robotics and cameras and great software, we're able to do surgery through small little incisions and get our small instruments deep down into the recesses where the prostate's located, find the necessary muscles, nerves, and remove the prostate, preserving all the things that are important for a good quality of life afterwards.
Like the muscles and the nerves.
Exactly.
Well, let's talk even more about prostate surgery using the robot. I mean, is it like a robot wheels in and does this surgery? Why don't we need surgeons anymore, or urologists?
That's right. Robotics sounds like quite a technological innovation. It's not. It is a robot, but what it is a very delicate device that is controlled by the surgeon. We sit at a console with a three-dimensional viewfinder where we can look deep inside the body, look at the prostate, utilize very finely tuned instruments where we have our hands and our fingers controlling the machine so we can go inside, find the cancer, and remove it safely without causing any problems.
So you're driving the robot?
Exactly. It is completely under our control. We place all the instruments ourselves, and we we control the arms of the machine that do the surgery. It's like an extension, actually, of our own hands inside the body.
And it's smaller. You said the robot can get into through tinier incisions than a human can?
Exactly. In the past, it was very difficult to reach the prostate because it's so deep inside the pelvis. But with these instruments, each one probably the size of my finger, we're able to go way down to where the prostate's located and delicately remove it without causing any disruption to the things around.
Well, that is absolutely fascinating. And our Champions of Care reporter team went on location to watch one of your colleagues, Dr. Sarle, perform exactly such surgery with a robot, and we have it to show our viewers. Let's take a look.
This is the Da Vinci S surgical system. The word robot is kind of a misnomer. It's not really a robot. It's really a remote control surgery device. You use your hands to control the instruments. The feet allow us to kind of it's like driving a car. You can brake, you can clutch to move the instruments and actually control the camera too. The prostate is located deep in the pelvis, and historically, the traditional operation called a radical prostatectomy was limited by the fact that it was very difficult sometimes to see the anatomy deep in the pelvis. But now, with the aid of the camera, see the camera right now is deep inside the patient, right next to where we're working. The lens actually has two cameras. It doesn't provide a 2D view, it provides a 3D view. Traditional laparoscopy, unfortunately, you basically don't have a wrist. Whereas when you do the robot, the robotic instruments that I'm driving actually move in more degrees than my wrist does. And so it allows us to be much more precise with the operation than we would with traditional laparoscopy. I look at the relationship between my patients and myself as a doctor as a kind of a team approach. What I like to do is involve the patients in the decision-making process, whereas I give a kind of a list of options, and we review the pluses and the minuses of each of those options so they can make an informed decision with their family about the best way to care. When someone is seeing a doctor for any surgery, I think it's very important for them to talk to the surgeon about that individual surgeon's experience. You know, what we found with studies done on prostate cancer is that high volume prostate cancer surgeons have better outcomes. What has to happen is you have to have an excellent team of people in the operating room working with you, and you have to have an excellent surgeon who's really experienced with the technology. At Oakwood, we're very lucky to have a very experienced robotic team. The people at Oakwood who do these operations have done hundreds of these operations, and they really know how to really set things up properly, and that really makes it easier for the surgeon to do an excellent job on their patient. If someone is very thin and in excellent shape, the surgery can take less than 2 hours easily. The prostate is kind of in a space in its own little area in the pelvis. It's kind of hidden, and we have to kind of move things out of the way to get to the prostate. So what I explain to patients and students is that the prostate's really like a scoop of ice cream on the bladder, and the bladder is the ice cream cone. And basically the operation entails us taking the ice cream off the ice cream cone. We have to take it off very carefully and peel structures away. So the prostate is removed from the pelvis, but then we have to begin the reconstruction portion of the operation. We actually put it in a little tiny little bag right now so we don't lose it, and then we come back and get it later. It's one of the last things we do in the operation.
I really like making a difference in people's lives to help them beat these diseases that can impact their quality of life, and I find it to be very rewarding every day that I can get to do that.
Dr. Ahmed, what are a patient's main concerns about surgery in the first place?
Now, it's a very good question. For prostate cancer in general and surgery in particular, the biggest concerns regarding men are two. Number one is erections and sexual function after surgery, and number two is bladder control after surgery. The recovery for surgeries are fairly short, certainly with the robotic surgery. Within a few days, people are home, and within a few weeks, they're back to regular, normal activities. But the sexual function does take several months to come back if the nerves are preserved. Sometimes the nerves cannot be preserved in order to prevent the cancer from coming back.
The goal is get the cancer out.
Exactly, and then secondarily maintain quality of life. The second issue of bladder control is also a concern, but we know that well over 90% of men have good bladder control eventually after surgery when all the muscles and nerves are preserved. And that's why the robot and all of our newer technology is so helpful, because we're able to see those nerves, see those muscles, and preserve them so that the quality of life is just as good as before surgery.
So for those two main concerns, there's great linkages to this robotic surgery because the small incision allows you to do more to preserve nerves and muscles.
Exactly, the incision and the magnification that's needed. And also, men do need to put in their own effort. There's exercises and rehab and medications that are done that help things along, that our understanding of these problems has really increased tremendously over the last few years. And a combination of therapy, preserving the nerves and muscles, and getting the cancer treated, I think will result in a good quality of life, cancer-free.
And is prostate cancer like other cancers, that the prognosis is so much better the earlier you catch the disease?
Really it is. Not only is the prognosis better, but the surgery can be less aggressive. So you're better able to save the nerves and muscles when there's less cancer present. So the sooner you catch these things, certainly the better for everybody.
So we've heard you say there's been a lot of technological advances recently. Is the prognosis now pretty good for prostate cancer patients?
Prostate cancer prognosis is excellent overall. We must also always remember that it is a second leading cause of cancer-related death in the United States, so it is something that we worry about. But fortunately, with early detection, prostate cancer can be treated, and people do very well. In early stages of prostate cancer, well over 90% of people stay cancer-free for 10 to 20 years.
So the main goal is get these guys into their physician's office to get tested in the first place.
Exactly, and just be reassured that if they are tested and they do find out they have cancer, the treatment options are very good and overall symptoms are fairly minimal after
Well, you know, we had the opportunity to talk with a patient of yours on videotape. Let's take a look and see what he had to say.
Great.
My name's Craig Hodges, and I had found out September 2nd of 2010 I had prostate cancer. I go to my primary care physician, and I basically get a blood test every 6 months, and he told me that my PSA numbers were elevated. And he said he'd like to have me go see Dr. Ahmed. And so I did, and Dr. Ahmed did a biopsy on me, and actually found a lump and then did the biopsy, and we went from there and found out I had cancer, prostate cancer. Quite a blow to you right at the beginning, and you know, I had my wife there, and you really don't know what you have a million things going on in your mind.
Well, I was surprised at first because I really didn't think he would have cancer, but yeah, fear, because I was just not so much worried that we wouldn't get rid of the cancer, but just getting to that point, whether it be surgery or whatever. I just was fearful for what he would have to go through.
Dr. Ahmed was quite the very personal person, you know, lets you know all the information that you need to digest.
Every time Craig had an appointment, I was always with him. Dr. Ahmed was always very clear about all of the different options we had, and just always wanted to make sure that I was part of the decision-making process, and that I would be there to support Craig.
We had almost a 2-month period to decide what we were going to do. Dr. Ahmed recommended to have the surgery because it was still contained and it hadn't spread outside the prostate.
So he had the surgery on the Thursday night, and by Saturday morning we were taking him home. And it was just amazing to see him walking around with no pain, just a little discomfort.
I work with 4 gentlemen who have had the same Da Vinci procedure, and they're all doing fine. And I just can't believe how many men are getting detected with this cancer. And it's very surprising to me when you don't read about it, and then all of a sudden it happens to you. Wow, you go with the computer age, you're going online and researching it, things like that, and you're quite surprised on how many men are being detected with it.
And by the time they did detect that he had the cancer, it was a fairly aggressive cancer, which was one of the reasons why Dr. Ahmed thought surgery was probably the best option, also at his age. So absolutely, I mean, if he had not had that PSA test done, we probably would not have found the cancer when they did.
We got it early, and we're keeping our fingers crossed that every time I get a blood test, it's not detectable, the cancer. Well, on Father's Day, I did run for the ribbons. It was a 5K run walk. We completed it. We plan on going next year also to just support the survivors and the men who don't come through with the cure.
Really uplifting, and it was really emotional because there were a lot of men that were survivors of prostate cancer. So I get emotional this time. I almost forget sometimes that he even got diagnosed with cancer and had surgery. It's been almost a year now, but Craig has done so well. He recovered so well from the surgery, and very few side effects. It's really been a wonderful thing.
Dr. Ahmed, what's the most important information you could give a prostate cancer patient right now?
Well, they need to have a lot of confidence in the place that they're going to get treated, and they need to get treated early. I'm really happy at Oakwood Hospital in that we have a great robotic team, a great radiation team, and a multidisciplinary unit with radiation oncologists, cancer doctors, urologists, pathologists that get together weekly to review cancer cases and go over best practices. So I think patients should find a place that offers these things, and that way they know that they'll be treated well and they'll have a great outcome.
Well, that's good advice. And if someone wants to find out more about you, they can check out your website, Dr. Muzammil Ahmed, on oakwood.org, or call 543-WELL, 1-800-543-WELL, to be connected with you. Thank you so much for being with us today.
You're very welcome.
I also want to thank Dr. Surendra Kumar and Dr. Richard Sarle for their expertise on prostate cancer. For more information about prostate cancer, the physicians you've met today, or other men's health issues, please go to oakwood.org or call us at 1-800-543-WELL. You've been watching Champions of Care, brought to you by Oakwood Healthcare. Thanks so much for joining us.